Now I'd like to introduce Dr. Sue Whiston of Indiana University. Sue is a full professor. She's really one of our foremost experts in the country on vocational psychology outcome research. She has been urging us through her scholarship for years to measure the effects of our interventions. And I see this work as a really critical piece in our ability to move forward and influence public policy. And I'm very pleased to share with you that Sue is also the chair-elect of the Society for Vocational Psychology. So Sue is our next speaker. Please welcome her.
I'm Sue Whiston, and I'm very happy to be here. And for every speech, you're supposed to start with a joke. And I only know very few jokes, and one that I learned a while ago was, how many vocational psychologists does it take to screw in a light bulb? The answer is one, but he or she needs an interest inventory to do it. Well, as I stand here before you, and I'm going to make the case of the challenges in making the case for the vocational intervention's effectiveness, I'd like to say that there are no challenges, that we can present solid science to policymakers who are done let me, hold on a minute, I'm a little nervous about this with the web. Okay, that policymakers simply ignore the solid science that we present to them in carefully drafted documents that are systematically presented to key decision makers. I'd like to launch into a diatribe now about policymakers, but I'm not going to do that because I think if there's a diatribe that needs to be made, it needs to be made for us, vocational psychologists, in making the case for the effectiveness of vocational interventions. Let's start with the need to make a solid case for the science of vocational interventions. We can convincingly conclude from several meta-analyses that vocational interventions are moderately effective, that the effect sizes range from about the 0.30 to 0.40 range. However, moderately effective is not going to get most policymakers yelling wahoo or some derivative thereof. So we need to look at now the questions of what works with whom under what conditions. Now we do know some about what works for whom under some conditions for career choice outcomes. And career choice outcomes are typically measured using measures of career maturity, career decidedness, and career decision-making self-efficacy. We do know about what works for some people in terms of those career choice outcomes. And we know that if we provide written workbooks or written exercises, individual interpretation and feedback, in-session occupational information and exploration, modeling, and provisions for support, those will have an impact on career choice outcomes. We can thank Steve Brown and his colleagues for this, and I think that this deserves a wah in the wahoo continuum. Okay, but there are still challenges in making the case for the effectiveness of career interventions. First and foremost, we need to produce more process and outcome research. Numerous studies have documented the decline in vocational outcome research. Intervention research is not easy to do. Furthermore, we need to do it with populations other than college students, as much of the research has been done with college students. I once did a review of over 50 years of research, and 49% of the studies had been done with college students. Nothing wrong with college students. We still need to know more about them, but what we truly need to know more about is those who have been marginalized and disenfranchised, and that is hard research to do, but we need to do it. We only need to look at the nightly news to know that that is an increasingly larger group, and that our research has an international importance. Paradoxically, as unemployment has risen in the United States, the number of researchers in the United States who are doing process and outcome research has declined. There have been times in the past where there has been a surge of vocational intervention research, and in my view, this weekend can best be spent by returning to that time of productivity and synergy. Now, please note that I use the term synergy, as I think there are many challenges in making the case for the effectiveness of vocational intervention, and everyone in this room can contribute. One significant challenge in making the case for the this is a Mac, I'm not used to a Mac. One of the significant challenges in making the case for the effectiveness of vocational interventions comes from how we measure effectiveness. Spokane, and I see Arnie here, and Oliver in 1983, which was almost 30 years ago, asked for a battery of, Arnie was 3 at the time. They asked for a battery of outcome measures to be developed that could be used for this kind of research. We have still not been able to do that. We still continue to use measures of decidedness, maturity, and self-efficacy. Not that these should be dismissed cavalierly. They shouldn't. They have significance. But we need to keep refining our measures and show that they have practical relevance. We also need to band together to support the use of more politically relevant outcome measures that incorporate indicators of employment, school completion rate, and indicators of quality of life. These are not easy constructs to measure, but we need to move forward with these in order to show the effectiveness of vocational interventions. Now, many of these indicators of effectiveness require longitudinal studies. Longitudinal studies are known as the career killers. But maybe it's time for those of us who have tenure to step up to the plate and start these studies. There are more challenges in making the case for the effectiveness of career interventions that use more than longitudinal studies or policy-friendly outcomes. I'm often asked to supply the names of empirically based or empirically supported vocational intervention programs for middle school students, adults, or even college students, and I cannot respond to these requests easily. I think we have neglected the development and the evaluation of treatment protocols. In my experience, policymakers, administrators, and practitioners want vocational interventions that have been shown to be effective. I know the treatment manuals that have been developed and have been used for 1 or 2 studies and then left on the shelf. Now, what I'm doing now is looking meaningful at a couple of people in this audience who have been the ones that have developed those treatment manuals, yet they've not been produced or used by practitioners out in the field. That's something that we need to change. If we want to inform administrators and policymakers about effective practices, then we need to evaluate those specific practices and be able to document that those specific practices produce meaningful results. I don't want to debate whether treatment manuals stifle creativity, as we need treatment manuals or treatment protocols that incorporate best practices, such as the 5 critical ingredients. Then we rigorously evaluate those, and then we translate them to the field so that practitioners can use them, knowing that they're using the most effective practices that are there. If we want to meet the challenge of what works with whom, under what conditions, then we need to describe the what more precisely. The active evaluation of vocational intervention should involve multiple studies using various methodologies. Therefore, both qualitative and quantitative studies are needed. Now I'm going to say a dirty word. And the dirty word, I know Scott's bracing, and I know a few other people that know me are wondering what in the hell I'm going to say. But the dirty word that I'm going to say is clinical trials. Whoops. Well, clinical trials should be here, but it's a dirty word, and so we're not going to put it up there. Clinical trials involves the random assignment to treatment and versus control, and some of you will say it's unethical to withhold vocational interventions, whereas I don't disagree with those concerns. I think there are creative ways to solve those concerns. We can use weightless controls. We can use comparisons to treatment as usual. This, however, is not easy research to conduct, and if we're doing clinical trials, we need large-scale studies. Policymakers want to see large N's, and they want to see simple graphs that document the effectiveness of vocational interventions. That is something we need to do. It's not easy, being in rural Indiana, to get large sample sizes. So what I would like to suggest that these challenges are not insurmountable if we work together and we use each other's expertise and resources. Large sample sizes are not the entire panacea that will make for the effectiveness of vocational intervention. According to Tony Watts, we should attend to productivity. Productivity is conventionally used by economists as a concept that relates to output to a given input. To put it simply, we're interested in bang for the buck. For many policymakers, it may not be that they're not so interested in whether vocational interventions are effective or not. They're interested in whether they're cost effective. This is a time when unemployment rates are staying stagnantly stable at 1 in 10 people. If we can show that career interventions have an impact on unemployment, then we can easily show that vocational interventions are cost effective. Not only does unemployment cost the government directly, there are also indirect costs associated with both physical and mental health. Unemployment, however, is not the only metric. There are also educational outcomes. If we look at high school graduation, a recent study found that for each dropout who graduated from high school, he or she would contribute $209,000 in higher government revenues. Furthermore, another study estimated that just for the state of California, the annual juvenile crime costs associated with high school dropouts is $1.1 billion. And that's only for the state of California and only each year. Think what that would do for our economy. We also know that there are health benefits associated with having meaningful and satisfying employment. As David Blunstein will talk to us later about, not everyone has the luxury of meaningful employment. But that is something we need to work on and that we can do, and that this will benefit both their mental and physical health. So let's return to cost effectiveness. It doesn't matter whether we're using employment outcomes, educational outcomes, or healthcare outcomes. What is important is that we show the cost effectiveness of vocational interventions. That's critical to us. In conclusion, there are many challenges in making the case for the effectiveness of vocational interventions, but I would prefer to view this time as a time of diverse opportunities. Many of us in this room have seen the positive effects of vocational interventions. We've worked with our clients and we've seen it. We need to show it now. These are both challenges and opportunities for which to build on. I think we can build on this. I apologize. Anyway, I think we can build on this case by, 1, conducting more research on the effectiveness of vocational interventions, using good and diverse outcome measures, developing treatment protocols that can be tested and used in the field, work together so that we have large samples and large clinical trials, provide solid evidence that vocational interventions not only help people and help diverse people, but they also are cost effective. I think this is a time of opportunity. I think it's a time to advance our field, a time to help more people, and a time that we can meet the challenges for making the case for the effectiveness of vocational interventions. I think the question for us is whether we are going to take advantage of these opportunities, and I hope the answer to that question for each of you is yes. Thank you. And thank you for putting up with my nervousness today.